is Dr. Lester Hartman. I'm a pediatrician at Westwood Mansfield Pediatrics. Anything discussed here today is solely for the patients at Westwood Mansfield Pediatrics. If other people listen to this, they should seek advice from their pediatrician to see if it's the same advice. Today we're going to talk about something called tics. In other words, simple motor tics. Not the bug, but rather the repetitive movements that kids do. First of all, 1 in 5 children have tics. We rarely see that many kids in the office. What it usually ends up being is somebody blinks a lot, rolls their eyes, sniffs, clears their throat, short staccato cough, or they'll do a motor thing like this, or touch the bottom of their shoe. That is a simple motor tic. Then there are also vocal tics, or making noises and things like that. But much more common is simple motor tics. And these develop pretty much any age, but probably closer to when kids are at school age is when they come into the office here. Usually they bother the parents. The key is they don't bother the child, they don't bother the child's friends. That's what's important to remember. It doesn't bother their child's friends. If your child is social, has no problems with people, even though you can see them having tics with their friends, which I had that experience with my oldest daughter. I'd watch her do with her friends, and when she was 5 years old, and none of them seemed to care, with this. So it's really important for you to realize that don't get anxious about this, because it isn't something to be anxious about. Now, some kids suppress their tics somewhat. It's a strange voluntary, involuntary situation, and they will really let go more of the tics at home. So sometimes that's why parents see it more. If it really bothers you, you can ask the child to try and stop for 1 minute, but don't expect them to stop. They can't do that. 1/3 of kids with tics resolve by the time they're in adolescence. 1/3 by the time they become an adult, and 1/3 get better but never completely go away. So 2/3 of kids, these will resolve anyway. What causes them, we have no real clear idea. It's something developmental in the brain, and we don't understand it. The issue around what people worry about Tourette's, that's less than 1% of people who have tics. And the definition is waxing and waning motor and vocal tics for greater than a year. The associated problems like ADHD or obsessive compulsive disorders are very rare, and only about 1% of kids with Tourette's will have the coprolalia. More will have as I said, all have waxing and waning and motor tics for more than a year. But the coprolalia means saying potty talk, talking about bowels and things like that, and using curse words. That's extremely rare in the overall picture. So remember this, 1 in 5 kids have tics. Less than that comes into the office. Treatment is deemed when it affects a child socially, not with the parents. And it's especially difficult for parents sometimes in the winter when a child may be sniffling or clearing their throat. Parents also worry a lot about, do they have eye problems, allergies, sniffing, and those are the things they get concerned about. So, and all those things are almost always negative with tics. So this is Dr. Lester Hartman talking about tics today. And if you have any questions, feel free to call the office. Have a good day.